morning and welcome back on MQR AICVG TV. I am Dr. Swati Naik and I am privileged to have with me very beautiful, very enthusiastic, energetic, none other than Dr. Maninder Ahuja. Thank you very much ma'am for joining us on MQR AICVG TV. She is the Vice President of Foxy in 2012 and 13 and she is going to enlighten us on a very important topic, that is cervical cancer screening. May I begin with the first question, ma'am? Why is cervical screening is so important?
Thank you, Swasti, for the kind words. Cervical cancer screening is very, very important because once the women they have been saved from maternal mortality, which we are improving, they need to have better quality and life expectancy also. And the cancers are becoming one of the major reasons where we are not working for their mortality in later on years. So we have about 2,65,000 cases of cervical cancer everywhere, and almost half of them die. And that is because we are not doing proper screenings and vaccinations.
Absolutely. So it's a very serious, it could be a serious problem if we are not screening it well in time. So that leads to me a second question, ma'am. Whom to screen and how to screen?
I think before screening, should we come to the vaccination part?
Okay.
Because we have two methods of preventing cervical cancer. One is by vaccinating and second is by the screening. Now vaccinations should start early at the age of 9 years to 15 years before the girl child has had exposure to the sexual contact. And screening then comes on later on because cervical cancer has a long precancerous course where we can screen these women. But we don't want to screen them earlier also because HPV virus, which is the cause of these cervical cancer, tries to clear it off from the genital tract in almost 80 to 90% of the women. So those women who persist with that virus, these are the ones who are going to get the cervical cancer.
Absolutely.
So that's why in poor resource countries like ours, if we start screening after 21 or 25 years or maybe once in a lifetime screening at the age of 30 years with HPV DNA and LBC combined is going to go a long way in reducing the mortality because of the cervical cancer.
Absolutely. So the age 9 wherein the child is or a female child is going into the school, at
Yes.
that age the vaccination is equally important.
Yes.
Ma'am, is there any school programs or the awareness in the schools about this cervical screening
Indian
program?
Pediatric Association has also taken up cervical cancer screening its program, but the government of India so far is not able to afford it because of the high cost of the cancer vaccine. So at some places like in Punjab and other places, they have acquired some vaccines, like about 10,000 vaccines, and they are vaccinating the girls. But if we consider the vast country of ours, that's just a drop in the ocean. So the vaccination will be possible only when the rates come down. So that is the universal vaccination. But even in the developed countries where it's being given free cost also, the coverage has not been more than 40 to 60%. So that means screening has to continue from the 30 years onwards to 65 years of age. So that is very important that we have to stop just at the 65 years of age screening methodology. Government of India is launching some program for screening also, but because of the communicated proper structures, infrastructure available, they are so far not being successful.
Absolutely.
So that's why Foxy has a large role to play with its 35,000
That's what my
gynecologists.
next question was. Is there any initiative from Foxy?
Foxy is
for
doing
certain-
lots of work on cervical cancer screening. I had taken it as my main agenda during my vice presidential year 2012 to 13 in Foxy. And at that time we had made all the modules for it. We had come out with a book also. And we were doing colposcopic workshops. Even Dr. Rishma Pai's tenure, they again have done the Prathashruti workshop, which I am the main member of that. And now we have come up with our own GCPR, good clinical practice recommendation for cervical cancer screening. So that is available on our website, and all the members please should go it, because now we have our own guidelines. So we should look into ourselves because our scenarios are a little different from Western countries.
Absolutely.
So here we have to do opportunistic screening, as though no structured program or the work from the government of India is available so far.
Okay, ma'am. Would you like to talk about that website? Is it a Foxy website or
It's a Foxy website.
It's a Foxy website and
Foxy.org. Please go
Foxy.
at foxy.org and you are going to get lots of information. Otherwise also, because we have got so many good clinical practice recommendations uploaded there, so many other materials are there, guidelines are there, the links to various our social security scheme and indemnity schemes are there. So as a Foxian, it's a duty of all the Foxian, if not once, at least once in a month, to visit that website.
Absolutely. Thank you so much, ma'am, for joining us on this special show that is MCure AICUG TV and sharing with us the important aspects of the cervical cancer screening. So the message goes here that the vaccination right at the age of 9 years and the screening at the age of 25 years, and that will definitely try to safeguard our women from the cervical cancer, which is a very preventable condition. Thank you so much, ma'am, for joining. Thanks
Thank you,
a lot.
Shwati. Thank you, MK.